Body dysmorphic disorder is often encountered in people. Famous one, and one of the example could serve Michael Jackson, which changes shape of the face, nose, chin, cheeks, lips, and even changed all the body skin from black to white. When you have a body dysmorphic disorder, you intensively focus on your appearance and body image, repeatedly checking the mirror, grooming, or seeking reassurance, sometimes for many hours each day. It is normal if you are looking at yourself in mirror, but not for many hours at the day. You perceive it flow, and the repetitive behavior causes you significant distress and impact your ability to function in your daily life. You may seek out numerous cosmetic procedures to try to fix your perceived flaw. Afterward, you may feel temporary satisfaction or a reduction in your distress, but often the anxiety returns and you may resume searching for other ways to fix your perceived flaws. Definition of body dysmorphic disorder. It is a mental health disorder in which you cannot stop thinking about one or more perceived defects or flaws in your appearance, a flaw that appears minor or cannot be seen by others, but you may feel so embarrassed, ashamed, and anxious that you may avoid many social situations. Causes. It's not known specifically what causes body dysmorphic disorder. Like many other health conditions, body dysmorphic disorder may result from a combination of issues, such as family history or other disorder, abnormalities in the brain, and negative evaluations or experiences about your body or self-image. It might be associated with genetics, especially if you have a relative or one of the parents with body dysmorphic disorder or obsessive compulsive disorder or depression, major depression, a chemical imbalance in the brain. And if you have a traumatic experience in the past, if you are teased, bullied, or abused when you were a child. Again, childhood is very important and have a great impact in your life later. Risk factors. Body dysmorphic disorder typically starts in the early teenage years and it affects both male and females. Certain factors seem to increase the risk of developing or triggering a body dysmorphic disorder, and including having blood relatives with body dysmorphic disorder or obsessive compulsive disorder. Negative life experience such as childhood teasing, which I counted, neglect or abuse. Certain personality traits such as perfectionism, social pressure or expectations of beauty or trending, having another mental health condition such as anxiety or depression. Preoccupation with your appearance and excessive thoughts and repetitive behavior can be unwanted, difficult to control, and so time consuming that they can cause major distress or problem in your social life, school, or other areas of functioning. How about symptoms? They include being extremely preoccupied with a perceived flaw in appearance that to others cannot be seen or appears minor. Strong beliefs that you have defect in your appearance that makes you ugly or deformed. Beliefs that others take special notice of your appearance in a negative way or mock you. Engaging in behaviors aimed at fixing or hiding the perceived flaw that are difficult to resist or control, such as frequently checking the mirror, grooming, or skin picking, attempting to hide perceived flaws with styling, makeup, or clothes, constantly comparing your appearance with others, frequently seeking reassurance about your appearance from others, having perfectionist tendencies, seeking cosmetic procedures with little satisfaction, and avoiding social situations. Once again, you can look at the mirror or look at yourself in the mirror. It's kindly normal as you should be certain that everything is okay. But if you are staying for hours in front of the mirror, it's a problem. You may excessively focus over one or more parts of your body, but the features that you focus on may change over time. The most common feature people tend to fixate about include face, face such as nose, complexion, wrinkles, acne, and other blemishes, hair such as appearance, thinning and baldness, skin and vein appearance, breast size too small or too big, muscle size and tone, and genitalia, of course. Or preoccupation with your body build being too small or not muscular enough, call it muscle dysmorphia, occur almost exclusively in males, and they are going to the gym and training hard for getting these big muscles. You may recognize that your beliefs about your appearance, perceived flaws may be excessive or not be true, or think that they probably are true, or be absolutely convinced that they are true. The more convinced you are of your beliefs, the more distress and disruption you may experience in your life. And finally, treatment. The symptoms of body dysmorphic disorder can get better with treatment if you have relatively mild symptoms of body dysmorphic disorder. You should be referred for a type of talking therapy called cognitive behavioral therapy, which you have either on your own or in a group. If you have moderate symptoms of body dysmorphic disorder, you should be offered either cognitive behavioral therapy or a type of antidepressant medication like selective serotonin uptake inhibitors like fluoxetine or paroxetine, and contact or join a support group. How about cognitive behavioral therapy? It can help you manage your body dysmorphic disorder symptoms by changing the day you think and the way you think, and it helps you learn what triggers your symptoms and teaches you different way of thinking about and dealing with your habits. Also, cognitive behavioral therapy will usually include techniques known as exposure and response prevention. This involves gradually focusing and facing on situations that would normally make you think obsessively about your appearance and feel anxious. Cognitive behavioral therapy is first. Selective serotonin uptake inhibitors is the second option, and it should be taken for at least 1 month, but for a full treatment you should take it for 4 to 5 months for the possible full recovery and getting better. Thank you very much for watching. Hope this video is useful for you and can help. If you are feeling sick, you can address to a doctor and asking for help.